So how many do you think that you can get 5 shots a day and 8 fingerprints a day? Yeah, I didn't think so. I don't think I could do that either, but I do know someone who does do it and has to do it every day for the rest of her life, and that's my younger sister, Grace. On July 6, 2011, that was probably like one of the worst days of my life. My mom's like noticing like some weird symptoms that she had. She was going to the bathroom a lot, and she was sleeping like 14 hours every night. And so they took her to the hospital, and they discovered her diagnosis of type 1 diabetes. And type 1 diabetes is the 8th most deadliest disease in the world. And this was like the first time that like I'd seen both my parents cry. So it was a pretty traumatic day for my family, but like she's okay now, and like we learned to cope with it. There are positive and negative consequences to like having type 1 diabetes, and these are kind of like the 3 main points in my speech. You kind of had to learn how the body produces insulin. You had to learn how to give yourself insulin, and the benefits that brought my family closer together, and now we're closer than ever. So how does the body produce insulin? Insulin's a hormone in the pancreas that breaks down all the carbohydrates that you consume, and it either raises or decreases your blood sugar level. So when you eat, your blood sugar rises, and insulin is the hormone that brings that down, and it's made in the pancreas. But when you're diabetic, your pancreas doesn't produce insulin anymore, so you have to give yourself injections and shots to give yourself insulin. And when your blood pressure is too high, it's called hyperglycemia, and when it's too low, it's called hypoglycemia. And according to Endocrine Web, after you eat, beta cells send signals to the pancreas to send insulin all throughout your bloodstream. And there's 2 ways to give yourself insulin. One of the ways is like by shot, so injecting yourself with it, or with the pump, which is more like technology efficient. And so these like steps describe how you give yourself a shot, and you take like a fatty area of your body, which is like highlighted up here, so like either like the back of the arm, the stomach, the back of the thigh, or like even the butt, and you like squeeze that area, and then you like stick in the needle. Sorry if any of you guys are like needle phobic. And then you slowly press in the injection of the insulin. And then the pump is you have an injection site, and there's a tube that leads into this pump, and you type in how many carbohydrates you just ate, and then it gives you the proper number of units of insulin to give yourself. Next, I'm going to tell you how to test your blood sugar. And there's like a pen looking thing, and you take the side of your finger, you don't take the front facing part, you take the side, and you press a button, and it just like pricks it, and it doesn't really hurt that bad. And you have to squeeze the side of it for the blood to come out. And then with the blood, you take the test strip and you put the blood on the test strip, and then you place the test strip in your tester, and it reads off your blood sugar number. And the average blood sugar for like all of us, we're probably right now between 80 and 120. But diabetics, they're like gold numbers to shoot for 100. And when my sister was in the hospital, she was at 900, and they said if we would have waited a couple more days, like she could have died. So here are some like symptoms that you may feel if your blood sugar is too low, so hypoglycemia. You can have drowsiness, muscle weakness, you can go unconscious, and like you can even die from having too low blood sugar. And then hyperglycemia is you're feeling fatigued, shortness of breath, you can slip into a coma, you have abdominal pain, and then that could also lead to death as well. And then lastly, I'm going to talk about like the positive outcomes that have come out of Grace's diagnosis. I have always like shared a room with her, and she's a really heavy sleeper, so when she wakes up in the middle of the night, like I know that something's wrong, like she's either too low or too high. And my family's really like come together to help her calculate like her carbohydrate intake, and like really like help her add up how many units of insulin that she needs. And when she was first diagnosed, when she was 8, she needed the shots because she was too young for the pump. It's a lot of technology for an 8-year-old. But then Recently she's been on the pump and it's been great for her and she's really been doing well. So then to kind of recap of all three of my main points, insulin again isn't produced in the pancreas. The average blood sugar should be between 80 and 120, but diabetics really shoot for that 100 mark. There's two ways to give insulin, either by the injection of the shot or by the technology-efficient pump. You test your blood sugar by pricking the side of your finger and it reads it in the tester. And the 8th most deadliest disease in the world can bring a family closer together, believe it or not. Thank you. Are there any questions?